When performing CPR on an adult, the most accurate indicator that compressions are deep enough is A. Hearing air escape from the mouth. B. Feeling the ribs move under your hands. C. Seeing full chest recoil after each compression. D. Watching the AED analyze the rhythm. Answer: C. Full recoil occurs only when compressions reach appropriate depth, at least 2 inches, and the chest fully rises back, indicating effective pressure and circulation. A victim with a pulse suddenly becomes unresponsive and stops breathing. The rescuer should A. Begin compressions immediately. B. Deliver 1 rescue breath every 3 seconds. C. Apply AED first. D. Check pulse for 30 seconds. Answer: A. If the patient with a pulse becomes pulseless, treat as cardiac arrest, start compressions immediately. Which action most reduces interruptions in chest compressions during AED use? A. Pausing until EMS arrives. B. Turning off the AED voice prompts. C. Applying pads while someone continues compressions. D. Waiting for advanced airway placement. Answer: C. Pads can be applied during ongoing compressions, reducing interruptions and improving survival. A child with an advanced airway in place requires ventilation at A. 1 breath every 2 seconds. B. 1 breath every 3 seconds. C. 1 breath every 6 seconds. D. 1 breath every 10 seconds. Answer: C. With an advanced airway, continuous compressions are given while ventilating every 6 seconds, 10 breaths/min. During CPR, the most common cause of failure to deliver adequate blood flow is A. Shallow compressions. B. Incorrect hand placement. C. Too many rescue breaths. D. Delayed AED arrival. Answer: A. Shallow compressions are the primary cause of ineffective circulation during CPR. The best way to confirm effective bag mask ventilation is A. Noting chest rise with each breath. B. Listening for air leak. C. Counting each ventilation. D. Asking another rescuer to observe. Answer: A. Visible chest rise is the only reliable confirmation of adequate ventilation. In a 2-rescuer infant CPR scenario, the compression to ventilation ratio is A. 15:2. B. 30:2. C. 20:2. D. 10:1. Answer: A. 2-rescuer infant CPR uses 15:2 to increase ventilation opportunity for pediatric physiology. The primary reason excessive ventilation is dangerous is because it A. Lowers oxygen levels. B. Increases gastric inflation and decreases perfusion. C. Causes the AED to malfunction. D. Raises blood pressure too quickly. Answer: B. Overventilation increases intrathoracic pressure, reducing venous return and perfusion. When using an AED on a patient with a wet chest, the rescuer must first A. Dry the chest. B. Remove all clothing. C. Start rescue breaths. D. Elevate the patient. Answer: A. A wet chest reduces pad adhesion and may divert shock. Drying improves conductivity. If a choking adult becomes unresponsive, the rescuer should A. Deliver rescue breaths first. B. Begin CPR starting with compressions. C. Perform blind finger sweeps. D. Sit the victim upright. Answer: B. Unresponsive choking equals treat as cardiac arrest, starting with compressions to dislodge the object. When delivering CPR in a moving ambulance, the most important action is A. Increase compression speed. B. ensure rescuer stability to maintain compression quality. C. Provide more frequent ventilations. D. Stop CPR until vehicle stops. Answer B. Effective compressions require steady positioning despite motion. A pregnant cardiac arrest patient should be positioned with A. Abdomen elevated. B. Manual left uterine displacement. C. Legs raised. D. Head lowered. Answer B. Shifting the uterus left improves venous return and compression effectiveness. For a drowning victim, the first priority is A. Immediate compressions. B. Ventilations before compressions. C. AED application. D. Checking for injuries. Answer B. Drowning is hypoxic. Early ventilations improve oxygenation before compression begins. A compression rate faster than 120 per minute is harmful because it A. Lowers heart rate. B. Reduces full recoil and perfusion. C. Causes fatal arrhythmias. D. Confuses the AED rhythm analysis. Answer B. Too fast compressions limit recoil and reduce forward blood flow. If an infant's chest does not rise with ventilation, the rescuer should first A. Increase ventilation force. B. Reposition the airway. C. Begin compressions. D. Attempt abdominal thrusts. Answer B. Improper airway position is the most common cause of ventilation failure. Which ventilation device is most effective when used by two trained rescuers? A. Mouth-to-mouth. B. Face shield. C. Bag mask. D. Pocket mask. Answer C. Bag mask ventilation requires two rescuers for optimal seal and breath delivery. During AED analysis, rescuers must A. Lift the patient slightly. B. Stop all movement and avoid touching the victim. C. Increase compression depth. D. Check blood pressure. Answer B. Movement interferes with AED rhythm detection. For a victim with suspected opioid overdose who is pulseless, the rescuer should A. Give naloxone before CPR. B. Begin CPR immediately. C. Provide ventilations only. D. Wait for EMS. Answer B. Cardiac arrest takes priority. Naloxone works only if there is a pulse. The AED advises no shock. The rescuer should next A. Restart compressions immediately. B. Deliver a breath. C. Reapply pads. D. Wait for a rhythm change. Answer A. A no-shock rhythm still requires high-quality CPR. Which patient most requires high-performance CPR? A. A patient with faint breathing. B. A victim with agonal gasps. C. A patient who is confused. D. A patient with slow but present breathing. Answer B. Agonal gasps equals cardiac arrest CPR required. A single rescuer should switch from child compressions with one hand to two hands when A. Compression depth is insufficient. B. The AED prompts it. C. The child weighs less than 15 kilograms. D. The rescuer becomes tired. Answer A. Two hands may be needed for proper depth depending on child size. When checking for a pulse on an infant, the rescuer uses A. Radial artery. B. Femoral artery. C. Carotid artery. D. Brachial artery. Answer D. The brachial pulse is easiest to locate in infants. A jaw thrust without head tilt is used when A. The victim has a suspected spinal injury. B. The victim is obese. C. The airway is clear. D. The rescuer is untrained. Answer A. Jaw thrust minimizes cervical spine movement. After 2 minutes of CPR, the AED says shock advised. The rescuer should A. Continue compressions while shocking. B. Clear the victim and deliver the shock. C. Ventilate before shocking. D. Remove the pads. Answer B. Clear the patient and deliver the shock to restart heart rhythm. When using an AED on a small child, if pediatric pads are unavailable. A. Do not use the AED. B. Use adult pads without touching each other. C. Place both pads on the chest. D. Provide ventilations only. Answer B. Adult pads may be used if properly spaced. A victim collapses during exercise. This most suggests A. Heat stroke. B. Sudden cardiac arrest. C. Stroke. D. Hyperventilation. Answer B. Sudden collapse during exertion is strongly linked to cardiac arrest. When performing CPR with an advanced airway, compressions should be at A. 60 per minute. B. 80 per minute. C. 100/120/min. D. 140 per minute. Answer C. Compression rate does not change with advanced airway. 2 rescuers are performing CPR. The compressor should switch roles every 2 minutes to A. Comply with AED rules. B. Prevent rescuer fatigue. C. Increase ventilation time. D. Allow pulse check. Answer B. Switching prevents decline in compression quality. A victim with a pacemaker requires AED pads to be placed. A. Directly over the pacemaker. B. Slightly away from the device. C. On the back. D. Only on the abdomen. Answer B. Pads should not cover the pacemaker, placed slightly to the side. Chest compression depth for infants should be A. 1 inch. B. 1.5 inches. C. 1/3 the chest depth. D. 2 inches. Answer C. 1/3 chest depth ensures proportional compression.